Good afternoon, everyone, and welcome to the Reducing Environmental Impact of Medicines. This webinar will take a particular angle of the role of health managers, and simply because the white paper that this webinar will launch has been produced, and the whole webinar has been organized by the European Health Management Association. So this explains our particular interest in the role of health managers. EHMA is a membership organization based in Brussels, whose mission is to foster excellent health management for a healthy Europe by providing the opportunity for debates, exchange of good practices and exchange of ideas. And you will see that by the panel whom we have brought to you today. My name is Annette Rusanov, and I'm the Policy and Program Director at EHMA, and I will be the moderator for today. This webinar is part of the World Antimicrobial Awareness Week 2022, running between the 18th and the 24th of November, whose motto is Preventing Antimicrobial Resistance Together. The webinar aims at presenting the recommendations outlined by the white paper, which I talked about. We will launch with this webinar, and my colleagues will actually post in the chat the availability, so how you can download the white paper. We would also like to raise awareness of how the health sector impacts the environment. We will discuss about good practices and how to implement them. And we would like to incentivize local national policymakers to take actions. But what is the agenda for today? We will first hear the white paper itself and its recommendations from Emmi Møller, policy officer at EHMA, who is the main author of this paper. And then we will have a panel discussion with a wide view, a wide range of views, because this is how, as I said, EHMA works and functions. And then we will open up the floor for questions. So before we start, let me just remind you of some housekeeping rules. We will record this webinar. You should remain muted during the presentations, and you can post your questions in the chat box. We will either read them out or we will give you the floor. And as we said, we will post in the chat the link of the white paper. We will also live tweet. So please do not hesitate to tag us as EHMA Info when you also live tweet during the event. So without further ado, then let me introduce you to Emmi Møller, who will present to us the white paper and the recommendations. Emmi, the floor is yours.
Hello, everyone. So as Annette said, I'm EHMA's policy officer, and I will walk you through some of the main findings and recommendations of our white paper. But first, I'd like to give you a bit of context. Next, please. So over the past decades, there's been a growing consumption of medicines worldwide. However, medicines are not always prescribed or dispensed appropriately, and likewise, patients do not always take their medicines in accordance with prescription guidelines, for example, due to lack of health literacy. The misuse of pharmaceuticals is not only detrimental to the health of individuals, but can also severely impact wildlife and ecosystem, particularly when pharmaceuticals are incorrectly disposed of. So at EHMA, we believe that the healthcare sector needs to lead in the way we procure, distribute, prescribe, and use and dispose of medicines, And we believe that health managers can play a key role in leading on that change, as they are the ones setting the framework and providing guidance, strategic vision, and leadership at organizational level. However, we've noticed that there are many recommendations out there on what, for example, industry or pharmacists can do to reduce the environmental impact of medicines, but we have seen a gap in recommendations addressed specifically for health managers and how they can contribute. Next, please. So the goal of our white paper was to identify strategies and best practices that health managers can put into place to reduce the impact of medicines on the environment. Next. So through our focus group discussions and wider stakeholder consultations, we have identified 5 stages in the medicine's life cycle that can be influenced by health managers, namely procurement, logistic planning and distribution, prescription, consumption and use, and finally disposal. Next. We have also collected 13 case studies from across the European region, highlighting some examples of interventions and good practices that have been implemented at each of these 5 different stages. And you can find all of them in the white paper. Next. So I will now walk you through the 6 main recommendations of the white paper. So first of all, the white paper highlighted the need to have standardized data collection at European level about emissions from, for example, greenhouse gases, wastewater, and solid waste within the health and care sector, but also and particularly on emissions related to medicines and medical equipment. The second recommendation is the need to share best practices on reducing the environmental impact of medicines amongst different stakeholders, and we suggest doing so by putting in place a European database of good practices. And I think our white paper with its 13 recommendations, 13 case studies, is contributing towards this. Next, please. So the third recommendation, and given that this issue is particularly complex to address, we really need to adopt a multi-stakeholder approach to reduce the environmental impact of medicines across their life cycle. So by establishing shared responsibilities among all stakeholders involved. This has been done, for example, in Belgium and Serbia, where they established partnerships between stakeholders for pharmaceutical waste collection, for example. And there's also a need to establish clear governance structures, both at policy level, but also at organizational level, that really promote sustainability. And one example is from the UK, where the National Health System has committed to a net zero carbon NHS initiative to become the world's first carbon net zero national health system by 2050. Next, please. So our fourth recommendation is that we need to make use of existing and future technology to prevent disposal of undistributed medication. This has, for example, been done in the Netherlands through the PharmaSwap initiative. And making use of technology can also help create transparency in the supply and demand of medicines, and also monitor prescription behaviors. For example, in Portugal, they set up a system-wide monitoring system to track medication, prescription, and dispensation patterns. And lastly, technology can also be used to improve medication adherence which is precisely the goal of the EU-funded project called Enable. Next, please. In the white paper, we also recommend increasing environmental health literacy, both in physicians and patients, and as well as this will also help reducing overprescription. And we also recommend enhancing physician and patient communication. This has been done in France, for example, through the eco-prescription project, where they looked at greener prescribing practices and improving communication skills between physicians and patients. There's also one example at a European level, which comes from the Global Self-Care Federation, who launched a charter for environmentally sustainable self-care. And the charter includes different action points, of which one is on actions to increase environmental health literacy in patients, and another action is about providing a platform for sharing knowledge on pharmaceuticals in the environment amongst different stakeholders. And finally, our last recommendation, next please, is the need to centralize processes in procurement, supply chain, and logistic to favor the purchase of medicines with low environmental impact when medicines are interchangeable. This has, for example, been done in Norway and also in Sweden, where environmental criteria have been included in the decision-making process when procuring medicines, which also in turn created a market demand for more environmentally friendly healthcare products and services. Centralizing processes can also help reduce medicine stockpiling and managing internal waste. So for example, in Tuscany, in Italy, there were 18 single hospital warehouses, and these were replaced by one centrally located warehouse, which reduced stockpiling and therefore also reduced the risk of medication expiry and wastages. So I hope I gave you a broad overview of the 6 main recommendations. You can find all the case studies and the details about them in the white paper. We've posted the link in the chat. Back to you, Annette.
Thank you, Emmi. And while we have all 6 recommendations fresh in our minds, so let's move to our panel for a discussion. We have invited Anna Prokupkova, advisor on health and environment policy of the Greens political group in the European Parliament. Welcome, Anna. Thomas Møller, project manager at the Secretariat for Sustainability in the Central Denmark region. Thomas worked at the Aarhus University Hospital as an environmental coordinator. His responsibility was to measure wastewater pollution and collect data on how much medicine is used. Welcome, Thomas. Sharon Pfleger is consultant in pharmaceutical public health at NHS Highland and co-founder of the One Health Breakthrough Partnership. Welcome, Sharon. And last but not least of all, Rhodes Baiao, Governmental and Public Affairs Manager at the Association of the European Self-Care Industry. He graduated as a pharmacist, and he also represents the Inter-Association Initiative in Pharmaceuticals in the Environment. Welcome, Louis. So to start with, you heard these 6 recommendations. How do they resonate with your respective organization's position on the impact of the environmental, the impact of their health activities on the environment? Who would like to start? Perhaps ladies first, Anna?
Good afternoon, and thank you so much. So first of all, I would like to thank EHMA for actually putting together these really great recommendations and this excellent overview. And I only hope that this topic will get a bit more prevalent in the European bubble and beyond as well, because we don't hear this topic in the whole health spectrum as often as we would like to, especially talking on behalf of the Greens now. So as an advisor in the Envi Committee for Public Health, my job is basically to mainstream the idea of the One Health approach, which is that we have the interlinkage between human health, animal health, and the environmental health. And so this and the green transition obviously is a big priority for the Greens. And my job is to find a solution how we can sort of mainstream this into the concrete legislative and non-legislative files on concrete proposals. So this paper gave me a lot of food for thought. And definitely I'm looking forward to working more with Emma on this when it comes to the concrete files that are open on my table. And basically it really does focus quite well on the recommendations for health managers from your end. But I think that we also on the European decision maker end must do our part of the deal and also make sure that there are high environmental standards already before the medicines come in the market. And I don't know if you remember, but in 2020, we had this resolution from the European Parliament on medicines in the environment, which was a reflection of the communication from the European Commission, but it went a bit beyond what the Commission said. And actually the Parliament demanded that this criteria of environmental assessment should be integrated in the risk-benefit assessment at the EMA, European Medicines Agency, when we do evaluation of medicines for market approval. Obviously, we would still look at efficacy and safety in the first place, but this should also be included as an angle. And we already do this for veterinary medicine. So we hope that with the review of the human medicines market, we would have this evaluation there as well. And obviously this would later help, since we would have the data, it would later also help the greener procurement at the national level. So definitely, I would be very glad if actually we would be moving more towards the prevention ends, because obviously now with the rising number of communicable diseases and non-communicable, and a lot of them connected to the destruction of the environment and biodiversity, this would be a very important topic to look at. And I'm looking forward to this panel. Thank you.
Thank you, Anna, and we are very pleased to have the European Parliament's point of view with us. Let's continue with Sharon. So, what do you think from NHS Highland point of view, Sharon?
Yeah, thank you, Annette, and thanks again for inviting me to the panel and for producing. I just chime with what Anna said for producing this report. So, how do the recommendations actually resonate with the organisations that I work with? Well, I'll give you a quick overview of 4 of the organisations that I actually work with. And to start with, I guess, at my health board level and Scottish Government level, I think historically when healthcare considered its carbon footprint, it really focused on the estate's functions such as heating, light, and the vehicles that we use. And it's only in the past, very recent past actually, that healthcare, the clinical work that we do, the clinical pathways, has actually become a thing that we have to try and work on. And that's sensible because about 80% of our carbon footprint actually comes from clinical pathways. So in NHS Scotland, I've recently worked with the government to produce the climate emergency and sustainability strategy, and clinical care is absolutely front and centre, highlighted there. And we considered the net zero agenda as well as the ecological crisis as well. So in that we address issues such as water pollution and good stewardship. So it really resonates with what we've put out in Scotland and what we're trying to aim for. In terms of my own health board in NHS Highland, every health board in Scotland now has to have an environmental and sustainability committee within it. And until recently, those committees, again, were populated by members from our estates teams. But now it's really great to see that the membership, the majority, is actually clinicians. So making a difference around the table, thinking about their clinical work and how we can make it more sustainable. So the recommendations that you have down here for sharing good practice, adopting that multi-stakeholder approach, really chime with me. And in fact, in our health board, we felt that we had to do so much about pharmaceuticals and the environment that we actually co-founded the One Health Breakthrough Partnership, which is a multi-stakeholder, multi-agency collaboration between our Environment Agency, SEPA, our water company, Scottish Water, and universities, University of the Highlands and Islands, as well as CREW, our Centre for Water Research in Scotland, and the NHS, because we recognise that all of us have got a stake in this. So we're taking upstream action instead of trying to deal with the problem whenever it gets into water, for instance, or into our soil. We're actually trying to prevent the impact and reducing the medicines further up the chain. So this report detailing what health managers can actually do at various points absolutely resonates with me. And lastly, working with the Royal Pharmaceutical Society in the UK is a society for pharmacists and pharmacy technicians, but the policies that we've developed actually are applicable to anyone working at any point in the medicines chain. So again, RPS is right up there on climate change and how we can make the whole journey of medicines use more sustainable. So thank you.
Thank you, Sharon, and thank you, Anna. Your pitch is already triggered further questions in my mind. So let's go to Thomas. So from your central Denmark regional point of view, how do you see these recommendations, Thomas?
Well, just as we've heard already from Sharon and Anna, I think they resonate quite well with what we're doing here. When we look at the data collection recommended, the leverage of technology, the increase of environmental health literacy, all these recommendations, yeah, they resonate what we're doing here. I'd actually like to compare with the picture I have of this whole situation regarding pharmaceuticals. I look at it a bit like a traffic accident, actually, in terms of that we're discharging so much pharmaceuticals through the wastewater and into the environment. And that's the damage, that's the accident. But I would actually like that we get really concrete on what does that accident look like? What kind of pharmaceuticals are actually the most harmful for our environment? And based on monitoring that and looking into that, developing a common European list that would actually be really supportive in terms of what we're measuring in the wastewater here as well, so that we can ensure that we have a common ground, a common platform that we can compare with across borders, because that's really the challenge, based on my experience today, that it's really difficult to compare the issue, the challenge we have in Denmark with the challenge we have in Portugal, because we're not measuring the same things. And if we start measuring the same things, we will have the same kind of profile or quality picture of the environment, the aquatic environment. And based on that, we'll be able to start formulating criteria to the quality of that, of the recipients. And when we have that, it's going to be a lot easier for the technology suppliers developing the treatment technologies to actually develop a technology that can address these quality criteria, because today it's really difficult for them. I know, based on dialogue with them, because we're demanding one thing in England, another thing in Denmark, and a third thing in Italy, and so on. So it's going to be really difficult for them to actually give what we need. So I'm talking for working across borders here, working on this on a common list, common quality criteria. That's one thing. That's about cleaning up from the accident, stopping the accident actually. And the other thing, of course, is to reduce our consumption. Wherever possible, stop using or overusing medical. That will be sort of those two things we can do to limit the impact that pharmaceuticals have on the environment. The other thing, and that's about calling for help, using the picture from the accident, is to start procuring more sustainable and implementing sustainability criteria in our tenders. And in that sense, we have to coordinate across borders as well, because no supplier will develop 20 different products, because we have 20 different profiles of sustainability criteria across Europe. So that calls again for looking at this in a common manner. And that's actually what we're searching for here as well. Looking for ways to do this in a common way, because the central region here that I'm working in, we're too small. It's just like, it's a little shop compared to the whole European market, and no supplier is probably not, at least, going to change their production or their product because we ask for it. But if we ask for it across Europe and for the same things, that's a whole different ballgame. So that would be my my comment.
Thank you, Thomas, for raising awareness of the cross-border collaboration. Thank you. Luis, from the self-care industry point of view.
Or from a general industry
point of view. From a general industry point of view, yes.
But first of all, thank you for the invitation to be here and to comment on the recommendations, and congratulations on this paper. I think that health management has a lot to do with the environment. We all have a lot to do with regards to the environment. We cannot just sink our head in the sand thinking this is not for us, because it is. What I most like about these recommendations is that they actually stem from case studies, they stem from reality, and they encompass what can be done in a full operation of healthcare, and in different parts where actually healthcare management can intervene. The interesting part of the case studies, that from what I've read, is that they are all very creative measures done at the local level or at the regional level, and they are put in place to solve real concrete problems by using sometimes innovative solutions, like the digital, which I think covers 4 out of the 10 case or the 13 case studies. And another thing is that they just don't shift or point a finger. They don't shift the problem either to the consumer or to the payer or to a supply chain stakeholder in particular. They sit together and they try to find a solution for the problem. And I like it that they also all have a plan, obviously, and an execution, but a part where they monitor the effectiveness of this solution that they present. I guess that my highlight would go for the disposal. I would say that the mess disposal programs are one of my favorites, and we are very engaged in these. As you well know, these are take-back schemes that exist in some countries to collect expired and unused medicines, which would otherwise be flushed or synced, which is still an aberration on the consumer side. But I mean, we need more awareness on those. Another thing that I don't think it's mentioned there, but it's very intelligent, that these take-back schemes actually have another virtue, which is to use reverse logistics of distributors to make sure that the delivery transports are not running empty. And this is optimizing the travels that are already being done and reducing in general the CO2 footprint of this delivery. How it resonates for us in industry: we are involved as payers or as organizers of these disposal programs, for instance, but that's not all that we do. We have for a decade now have been sitting together as industry, thinking and acting on what can be done. So we are involved in 2 major studies. One was on IMI, which is finished, and it continues on to IHI program, which is called Premier, and this helps to generate evidence, and this paves the way for evidence-based policies down the road on the risk of medicines and pharmaceuticals in general in the environment. We have also issued technical guidances for management of manufacturing effluents, which are one of the sources. I mean, they're a minor source, especially in Europe, but they are one of the sources. So it doesn't mean that we don't act on it. So we are engaging not only through this initiative, but also other global initiatives such as the AMR Alliance. And we are also developing further environmental risk assessment, which now exists at the marketing authorization level, but we believe that can be taken one step further for new medicines, for innovative medicines, in order to especially mitigate the environmental risk that some of these innovative medicines might have If we think of, for instance, anti-cancer drugs, these will obviously have an impact because of the way they work. If you think of hormones and other endocrine disruptors that we have to use for humans, it will have an unintended effect on biodiversity, obviously. So we need to create ways of making these products available while still avoiding them in waterways, in watercourses, in the general environment. That's, for now, what I would like to say.
Thank you, Luis, and thanks for adding the reverse logistics. No, it was not included. So thank you for bringing it to our attention. From your answers, and actually, as we worked on the paper, I have the sense or the impression that there is little or limited awareness about the impact of health activities in the environment. So to whom and how could we raise awareness, to your mind, Luis?
We are now exactly on the European Antibiotic Awareness Week. So that's one very good initiative that we are taking. And I don't think it gets praised enough and does not get echo enough in civil society, despite our healthcare bubble where we get a lot of it. I believe all efforts towards health literacy need to come supported nowadays with digital literacy and environmental literacy in tandem. These need to come all together. And as Anna said before, in the context of One Health, we should do everything we can, especially to prevent illness. And I believe that the health systems and health budgets do not invest enough on primary prevention. And I don't mean vaccines alone that are very popular now. I mean taking care of preventing communicable disease transmission and also to delay the onset of non-communicable diseases. And this means obviously avoiding sedentarism and what we all know, having a healthy diet, etc. But are we doing enough? I don't think so, because this only becomes true when we have behavioral change. And this step is where we don't do enough. I mean, after we leave school, where we might get a lot of information on these subjects, there are very few programs tackling society's needs for this awareness. And primary prevention does help reduce the burden on health system, saves clinical time, and saves the treatments for those who especially need them the most. And collaterally, it also avoids the environmental or reduces the environmental footprint of our clinical action in the products that we would use later down the road. On another hand, I think we need to have data and evidence on the risks of health-related activities to the environment. And here I speak mostly to regulators, obviously, and healthcare professionals, such as I am, and also to health managers. When we are aware of these risks, we can implement science-based measures to mitigate these risks. And healthcare is a basic need, and we need to ensure that everyone has a fair, equitable access to health assessment and treatments, obviously. And here I would mention, for instance, the X-ray contrast agents, which are terrible for the environment. But we don't just decide to ban them. We have created in their authorization process a way to mitigate this risk for the environment. By collecting urine in special bags for elimination. So this avoids them going into further effluent. And when the health management knows that, when the health unit knows how to do it and how to proceed with these products, they balance the access for the diagnosis in this case, and they balance the environmental risk.
Thank you, Luis, for so the primary prevention, the use of medication, actually, and then science-based measures, and I understand. Thanks very much, Luis, and perhaps Thomas, would you have some advice on awareness raising?
Thank you, Annette. Yeah, I have a few comments. I'd like to add to what Luis said. A lot of things he mentioned in terms of creating awareness, I can agree on, especially leveling or heightening awareness on a political level. That's really crucial. That create that awareness among these people that there's a challenge here and we have to address it. And we really need their help. On top of that, I'd like to stretch and give an example of the challenges that we're facing as well in terms of data and those data and the quality of those data we have available. For instance, if we start working, or when we start working implementing criteria on, for instance, carbon dioxide in our tenders, normally the numbers you will have from the databases that are available today, they are based on economic numbers. This means that when you go into the market and ask for a specific pharmaceutical, and let's just imagine that the procurement department here in our region do a really good job, and they receive an offer on a specific pharmaceutical 30% lower than they expected. Then the way we calculate and measure our carbon dioxide linked directly to economic numbers means that because the price is 30% lower, the emissions of carbon dioxide is equally lower. And this gives, of course, a completely wrong picture of reality. So there's a huge assignment here on calculating and measuring those scope 3 data that will allow us to actually talk more specifically about what is really the challenge here, and heighten that awareness and that knowledge among politicians as well. Also explaining them that we actually need resources to solve this challenge, because we can't make specific calculations, can't heighten their awareness, their knowledge based on the data and the knowledge we have today. So that's part of getting in contact with them. That other than just talking with them and explaining there's a challenge, we have to explain that we actually need resources. We need to coordinate this work that we're doing across borders to actually solve the challenge. I think that would be it for now.
Thank you, Thomas. And in your answer, actually, you mentioned policymakers and the political level. We know that having the political support for a particular challenge or issue helps a lot, not only for giving more funding, but it's also the kind of awareness indeed that we raise around that particular issue. So how could we particularly raise the sustainability question on the political agenda, Anna? What would be your advice coming from the European Parliament?
Well, I can tell you that, anything on the political agenda needs to be urgent. And obviously this sense for urgency, now if you're talking about the environment, is obviously there. We've seen COP27, but then we've also seen that, not everything translates from the political speech when we are talking about the Green Deal and One Health approach on every single level. Not everything translates to concrete action. And that is usually the more difficult part. So you have a big divergence between if someone makes a speech or if someone, even votes on a resolution or puts something in a resolution. And a completely different thing is if you're talking about something binding. If it's an international agreement, if it's a European law, it's the same thing. So also at the same time, we are still feel like this environmental question, or at least in minds of a lot of people, it's still in competition to, oh, this is going to threaten our jobs and growth. So we cannot talk about the environment because, this is against the industry. But we need to rethink that. We need to innovate the industry to where they're part of the solution, not that it's the environment versus jobs, growth and industry. So this needs to be a bit of a cultural change as well for many people, I think, and many politicians as well. So for instance, we have a debate in the Envi committee whether or not to split it in two, in environment and health. And again, this as Greens we oppose, because we would like to see the One Health approach and to have the environment and health treated together. So and like it's already a problematic if you have one sort of legislative file, and let's look at the ITRE committee, for instance, that's the committee for industry, and then the ENVI committee for the environment and public health. They often deal with the same files, but they have completely different sort of priorities and perspectives that are often clashing. So that's another thing. We deal with it in silos, and it's the committee that has the bigger lead that in the end has the final say, which also creates a problem how to translate this sustainability question in the final texts. But you know, your paper was excellent in terms of pointing to the problem and suggesting some solutions, sort of especially for the health management. And for us, it would be also great to look at how can we translate this sort of into concrete amendments to different files. So now I was also thinking, oh, what do I actually have on the table that would be related to this topic? And it's actually quite plenty of things. So for instance, the European health data space, you also mentioned, you know, we need to monitor more data to know the environmental impact and also link this to public health. Then we have the upcoming recommendation on the antimicrobial resistance that will be negotiated in the council under the Swedish presidency. We have the urban wastewater directive coming, which is massive because of the residues in water waste. We have the industrial emissions directive, the ambient air quality legislation, and also, for instance, the sustainability due diligence for companies to look at their adverse environmental impacts and the reporting. So there's actually plenty of things where these little bits can be mainstream and can be looked at how can we do it in the practice. And I must say that these case studies that you do are extremely helpful to really find the best practice that could be then, as Thomas mentioned it, you know, have it a bit more coordinated approach and coming from Europe, because indeed that would have a bigger impact. So as I said, 3 things I would say: political urgency, and then work on both levels, both on the political, sort of reach out to our big bosses and in the hierarchy, but also work in the detail on the technical level. And that's how you would achieve the success, I would say.
Thank you, Anna. And indeed, what you mentioned, breaking silos. So not thinking only from one point of view. And thanks very much for pointing to concrete legislative or non-legislative dossiers, which will be extremely helpful for us. We talk through the recommendations, we talk about shared responsibility. So obviously our point of view is health managers, but health managers should collaborate with NGOs, with industry, with policymakers. So this multidisciplinary approach, do you agree with it? And if you do, how could we foster the multi-stakeholder collaboration? Sharon, actually, you mentioned in your introductory speech that you have a multi-agency and multi-stakeholder partnership. So perhaps we could start the answers with you.
Yeah, I'd be delighted to. Answer your question, do you agree with multi-stakeholder collaboration? I don't think we can disagree with it. We have to agree because we're all, I like to think that we're all part of that bigger jigsaw and we've all got one piece that fits into it. But if one piece is missing, the jigsaw isn't whole, it's not a complete picture. And certainly my experience of co-founding the One Health Breakthrough Partnership and adopting that One Health approach. Before I go into that, let me just reflect on what we've all been through together since 2020, a global pandemic. And we've seen that no one country could fix that because we had people coming in and out of our countries. No one sector could fix it. Health couldn't fix it on their own. We needed industry to help us with vaccination. We needed other industry to help us with PPE, etc. So again, all parts of that win-win solution. And I think that's what you have to create when you're looking to work multidisciplinary or multi-stakeholder, is actually increase your understanding of the other party's challenges and also what they can bring to it. And if I give you an example, we started off about 4 years ago with an international conference in Inverness in Scotland. We invited many international players, different agencies, different actors. And at the end of the day, our water utility company and our environmental agency had this light bulb moment where they just thought, we can't do this on our own. We can't take pharmaceuticals out of the water because A, all the technology is not there, B, it's really expensive, and C, it would absolutely increase our carbon emissions. So for them, the light bulb was working upstream and making those interventions before the pharmaceuticals actually reached the water system. So we all understood what part we could play. We understood what the win-win was. And since then, all of the members have just been astonished at the amount they've learnt about the other sectors and how we actually all play in together. And previously, Scottish Water, SEPA, healthcare system, we would never have talked to each other. But now, daily contact and everything that we do, we ask each other about it before we set off to do it, because we know that the other agency will be able to help us. So yeah, absolutely agree. Big time with multi-stakeholder collaboration.
Thank you, Sharon. Luis, would you have something to add to that?
But totally, I believe dialogue is key, obviously, to progress in bringing healthcare solutions to people without harming the environment. But for this, I think we need to be open, as Sharon said. We need to be open to what other stakeholders say and believe we cannot do things as we have done before up until now. Of course, sorry for the proverb, change, even if it's for the better, is always hard and faced with resistance. We see also that it's easy to point fingers, as I said before, or to put responsibility on others, but each sector needs to look inside and see what is in their grasp to operate this change, and still be open to dialogue and to understand the problem from a different perspective, because what's priority for one stakeholder is not the priority for the other one. And when we all speak among ourselves, I think we can bring these creative solutions that we actually saw on your case studies. And some of these we know that policymakers are not aware of, because they know their reality, they know their constituency, they don't know the bigger picture or where the best practices can come from. And as I said before, this needs to be a cycle. We need to act to measure the outcomes of the action and the effectiveness of this change. And if need be, we need to change again. And I believe that the solution is also at the member state level. For as much as we try to put up European legislation, if it's not transpiring to the member state level, it will never be effective. And that's where the problem needs to be addressed. And by sitting together, the pharmaceutical and the water industries, because they're both industries, health and environment regulators sitting together, not sending emails from their ivory towers, healthcare professionals, obviously, environmental experts, who knows, they might come even from academia, and we need to sit all of them together. And here we need to find workable solutions for everyone, solutions that are sustainable from an environmental perspective, but also that follow our commitments, general commitments as a society, obviously, and that keep delivering on our social contract, which is to bring better healthcare outcomes for everyone.
Thank you. So this is the balancing, right? The social contract with the environmental responsibility. Well said, Luis. We have I sneak peek the question and answer panel. So we have good questions. But if you allow me still one question, to which I would expect a short answer, and then we could take questions from the audience. And to close the round of questions, as also Anna said, there could be excellent speeches and words, but they have to be followed up by action. So this would lead me to the implementation side of the recommendations. From your respective organizations, how could you support the implementation of these recommendations? And I would start with Anna, because you would actually introduce this time for action thinking.
Yeah, thank you so much. As an advisor, I have to take it immediately and immediately think, how do I do it? Starting with me, and then of course liaising with colleagues. that work more on the environment side, because I mainly do public health. But for instance, if we are looking into the obvious files, which are the pharmaceutical legislation review, and we will have a review of the big directive on general pharma, where actually a lot of these topics could be taken up. So this includes, for instance, the more move towards an open science in terms of clinical data, which means also reduction of research and potentially also reducing the animal testing methods, and yet generally duplication research. This could also be a huge help of the European health data space that is already published by the Commission. Then talking for antimicrobial resistance, obviously we need to do more in terms of boosting research into new antimicrobials, while also putting more safeguards on prudent use. As Thomas also mentioned, we are overusing those medicines and antibiotics. This is a classic example where we have this awareness week for a reason now. Then, for instance, another big one that keeps being echoed is bringing sort of production of pharmaceutical ingredients back to Europe, which would potentially also lead to sort of greener manufacturing, because we have higher standards here than, for instance, China or India. But of course, while also trying to make sure that in third countries those standards are also higher and higher, because it's not just on Europe to solve everyone's problems, or yeah, which is climate change. Then obviously we have in the treaties already the polluter pays principle, which should guide all of these different legislative texts that had to do something with industry. So that has to be reflected as well. Then we have the due diligence I've already mentioned, which is now quite a new concept at the EU level. Previously, it was at in member states, but now we are trying to sort of unify the rules, who should follow up on the adverse environmental impacts and how and to which extent. Then I've already mentioned the environmental aspects in the risk-benefit assessment of human medicines. Then we have already done this for the crisis product, but I think it's really important for other products as well, in terms of bigger transparency into supply chains, which will also give a better overview what stocks we have throughout Europe. And this will not only mitigate medicine shortages, but also prevent that we have expiring products on the shelves in different member states. And now obviously the COVID vaccines are on this aspect quite a big concern in terms of expiry. And last but not least, I was thinking also of packaging and labeling of medicinal products. So the less is more in terms of packaging, of course, and in terms of labeling, it would be good to have, for instance, a front label sort of instructions on how to dispose those medicines, which also leads to the increasing of health literacy, because I don't know how many patients actually do read a leaflet or give back medicines to pharmacy, but these are always helpful. And yeah, so that were the ones that immediately popped into my mind when I was reading your paper, but there are many more, of course.
Thank you, Anna, for this detailed list. And actually on the packaging, we will get back. Sharon, really just 1 minute.
Sure. So Anna's given us a great strategic overview. I'll come in from the healthcare professional. So I think spreading the word, absolutely, and sharing good practice. There are things in this paper that I didn't know about. So if I don't know about them, there must be lots of people out there that don't know. I give a big shout out in the UK to Pharmacy Declares, a group of pharmacists and other pharmaceutical staff that are actually sharing good practice and also reaching out to other professions. Again, with the Royal Pharmaceutical Society, we're doing that in Scotland, bringing all prescribing professions together and developing an action plan Also in Scotland, working with the Association of British Pharmaceutical Industry, and to take what Anna said one step further, actually would be really great to put the environmental risk information to improve health literacy onto patient packaging. So lots of things there. And personally, in Highland, we are working on a new prescribing framework, building on the work of the WISE list in Sweden, so that we can help our prescribers to make better eco-directed prescribing decisions.
Yeah, again, awareness raising. Yeah. Thanks very much to our speakers. And now I will quickly move to the questions. You can also read them in the question and answer panel. We had a question on the packaging, actually. You, Anna, said the less the better. Here we had a question on the recycled plastics, and actually, no, it's not part of our recommendations, simply because it's outside of the scope of health managers. But otherwise, indeed, it would be very relevant as a recommendation. I don't know if somebody would like to still respond from our speakers. Luis.
Yes, I think that we have several challenges with regards to packaging, and we are looking into it. It's not just bringing what the industry thinks and wants, it's also how do we integrate what society thinks and wants. Obviously, one of the main things that we need to deliver to patients is a safe product. We are technically yet struggling to see how plastics, because plastics have or play a part in how we deliver our products, because it's safe, and from a technical perspective, we consider extractables and leachables, so what can come from the plastic into the product. When we have to input recycled plastic, and this is a very technical answer, sorry for this, we don't know the provenance of this plastic and what the exact content would be. So we're still trying to make meets ends in order to see how we can also put this, if plastics are the future, if recycled plastics or recyclable plastics. So these are two areas where we are looking into what we can do in our industry. And obviously, as Anna has touched, how we can develop greener pharmaceuticals, but remember, it's not always easy, as these are biological biological active chemicals that will interact also with these species, but we hope for the future to be able to have them available where it is possible, or to the extent possible.
Thank you very much, Luis. Thomas, I'm just conscious about time. We have 2 minutes and we have 3 other questions. So 4 altogether. Thomas, let's come in with the answer, and perhaps we can take the other questions after the webinar bilaterally, so we can respond to them. Yeah, Thomas.
Okay, thanks. I just wanted to add to what Luis said regarding the packaging, that our procurement department here in the Central Denmark region have developed the common Nordic criteria for sustainable packaging in collaboration with the other Nordic countries. And it's something that we have informed the EU about, and I know that there's a process ongoing there. So just to put some spotlight on the fact that we are actually taking action on this, and things are moving forward in terms of finding a way, finding the balance between safety for the patient and safety for the environment as well.
Okay, so it's again balancing the two ends. Perhaps there is an anonymous question, and this is on the multidisciplinary approach. The person asking says that in his work or in her work, he often sees green initiatives in healthcare, either bottom up, so physicians led, or top down, health management led. How do you see these two sides coming together? So the bottom up and the top down, again, balancing up.
I can jump in there.
Sharon, yeah.
I think it's use your feet, move towards each other, because actually at the end of the day, you probably both want to work together and you want the same outcome. So I think it's a win-win. Just speak to each other.
Thank you, Sharon. I don't know, there are still two questions. Would you like to take them or are you in a hurry? Yeah, shall we? Okay, just then a quick answer on the EHDS, where actually we will give control to patients over their health records. This could be a good way of adding sustainability information, for instance, disposal at local pharmacy, etc. So it's again awareness raising, what that Anna talked about, right? Data. And who would like to come in?
Maybe I can come in on this one, as
yeah, it was part of your
negotiating this file as well. Yeah, I actually think it's a good idea. We are still, obviously, if you've seen the proposal, you know that it's quite holistic approach, and then there is a lot of questions to be answered. What data sets to be put in, which healthcare professionals have access to what, and so on and so forth. But definitely we will try to, again, with the One Health approach, try to also include the environmental aspects, including this in the health data space. But as to how that is up to a lengthy discussion, and at which level, whether we solve it in the Basic Act or this might be solved in the tertiary legislation with a lot of other things, that's obviously we will not know anytime soon, but it's definitely a good idea to have it as an aspect.
Thank you. And the last question, actually we all agreed on the health literacy and increasing health literacy, but Maria is asking how in the community in general, so how to increase health literacy. Actually, we have a concrete case study on that from Serbia, if I remember correctly. But would you have some good examples yourselves?
I've got an example, Annette,
yeah, Sharon.
Particularly since it's World Antibiotic Awareness Week. I think it's about getting the right way to get to people. Different people have different needs. One thing we did in the One Health Breakthrough Partnership was to develop a video about antimicrobial resistance and the impact on the environment. We pushed that out on social media a couple of years ago on this week and repeated it last year, and I'll be repeating it this year too. And the evaluation that we did of it actually produced some staggering results about how much people's education had been improved and how much their intended behaviour was going to change for the better. So it's about finding the right channel for the right purpose, I think.
Yeah, thanks very much. Jan-Louis?
Just quick jump in also to remind you that the medsdisposal.eu is there for you to share and to use social networks, as I think is a way of getting to people nowadays. And they have also Twitter and LinkedIn and other platforms. So medsdisposal.eu is just a collection of how to dispose of your medicines right in each of the EU countries, because sometimes they differ. Not sure if you are aware, but in Germany, it would be quite all right for you to put it on the garbage bin because it all goes into incineration. However, that's not the case in most European countries, as it goes to landfill and then it can go into waterways.
Luis, could you please just drop this link to the chat so that our attendees will have access to that. And with that, unfortunately, we have to conclude our event, although it was very interesting, and we realized we should have planned perhaps a longer event or having a richer discussion. So from your responses to our questions, actually what I have drawn together, and please don't hesitate to come in to complement if I forget about something. Tackling the environmental impact of health activities is never an either or choice. And you cannot take only one perspective into consideration. It is always an and. So mix, balance, synergy, collaboration. So a balance between the environmental impact on the medical treatment, this societal contract, as Louis said, in the short and long term, short and long term, but as Thomas said, in the short and medium term, but as Thomas said, in the long term, we have to reduce the impact. Collaboration between stakeholders. So we talked a lot about multi-stakeholder collaborations, and also Sharon highlighted system thinking, looking at things never in isolation, but in context and in relation to other factors, breaking silos, as Anna said. And the One Health approach that popped up several times. So looking at human, animal, and planetary health. Primary prevention, reducing the consumption of medication at all, and a cultural change, as Anna mentioned, and innovation, which I liked. Would you like to comment on these concluding remarks? Was it an accurate kind of summary of of many ideas that came up? If we could put up the slide with the white paper, so just reminding people how and where you can download the paper and what it looks like. So thanks very much, and don't hesitate to disseminate the white paper, and of course use it for your future work. Thank you, and have a nice afternoon.